Hey everyone, and welcome back to the channel. Today we're talking about something surprisingly common yet often misunderstood: gallstones. You might have heard of them, or maybe you even know someone who's had them. But what exactly are they, and why did they form in the first place? Stick around, because we're going to break it all down in a simple, easy to understand way. First things first, what are gallstones? Imagine tiny, hard pebbles forming inside your gallbladder. Your gallbladder is a small organ tucked under your liver, and its main job is to store and release bile, a fluid that helps you digest fats. These pebbles can be as small as a grain of sand or as large as a golf ball. They're primarily made of two things: cholesterol or bilirubin. Cholesterol stones are the most common type, looking yellowish, while bilirubin stones, also called pigment stones, are smaller and darker. So, the big question is, why do they form? It's not just one single cause, but a combination of factors that create the perfect storm inside your gallbladder. Let's look at the main culprits. The number one reason is having too much cholesterol in your bile. Normally your bile contains enough chemicals to dissolve the cholesterol released by your liver. But if your liver pumps out more cholesterol than your bile can handle, the excess cholesterol can crystallize and eventually form stones. Think of it like trying to dissolve too much sugar in a glass of water eventually. Some of it will settle at the bottom. This doesn't necessarily mean you have high cholesterol in your blood, but rather an imbalance within your bile itself. Another major factor is having too much bilirubin. Bilirubin is a yellow pigment that's produced when your body breaks down red blood cells. Certain conditions, like liver cirrhosis, biliary tract infections, or some blood disorders, can cause your liver to produce an excess of bilirubin. Just like with cholesterol, if there's too much for your bile to dissolve, it can form those dark pigment stones. Now let's talk about how your gallbladder functions. A healthy gallbladder regularly empties its bile into the small intestine. But what if it doesn't empty completely or often enough? When bile sits in the gallbladder for too long, it becomes concentrated. This concentration makes it much more likely for cholesterol and bilirubin to form crystals and then stones. This is why things like rapid weight loss or fasting can sometimes trigger gallstone formation. They disrupt the normal rhythm of your gallbladder emptying. So, who is most at risk? There are a few key risk factors to be aware of. The classic saying in medicine is female, 40, fertile, and fat, which, while a bit blunt, does highlight some real trends. Women are more likely than men to develop gallstones, partly due to the hormone estrogen, which can increase cholesterol and bile and slow down gallbladder movement. This is also why pregnancy and using birth control pills can increase the risk. Age is another factor. The risk of gallstones increases as you get older, especially after the age of 40. Your family history also plays a role. If gallstones run in your family, you might have a genetic predisposition. Lifestyle choices are huge. A diet high in fat and cholesterol and low in fiber can contribute to gallstone formation. Being overweight or obese is a significant risk factor because it tends to increase the amount of cholesterol in your bile. However, as I mentioned, crash dieting or losing weight very quickly can also be a trigger, so slow and steady is always the best approach. Certain medical conditions, like diabetes and Crohn's disease, can also increase your risk. So, to recap, gallstones are mainly caused by an imbalance in your bile: too much cholesterol or too much bilirubin, or a gallbladder that isn't emptying properly. Your risk is influenced by your gender, age, genetics, and lifestyle. The good news is that many people with gallstones don't even know they have them and experience no symptoms. When they do cause problems, it's usually because a stone is blocking a bile duct, leading to pain, nausea, and other issues. If you ever experience sudden, intense pain in your upper right abdomen, it's crucial to see a doctor, and understanding the causes is the first step toward prevention. Focusing on a balanced diet, rich in fiber, maintaining a healthy weight, and avoiding rapid weight loss can all help keep your gallbladder happy. I hope this helps demystify the reasons behind gallstones. It's a complex process, but understanding the basics can make a big difference. If you found this video helpful, please give it a thumbs up and consider subscribing for more health content. Thanks for watching, and I'll see you in the next one.